The role of physical therapy with chronic pain is teaching people that movement is okay, it's safe, and it's even encouraged. And so exercise and movement is medicine and can help reduce pain and improve function overall over time. The role of a physical therapist is to meet you where you're at. And so not this expectation that you're going to be lifting really heavy weights or doing anything that you don't feel comfortable with. So we evaluate you, we see what you're capable of, and then find ways to facilitate you to get stronger and get back to doing the things that you love with less pain. So what I'm going to do is take a little bit of time to show you what a typical session might look like with someone who is struggling with a lot of pain. Okay, so a typical session with someone that might be dealing with some low back pain, maybe even some upper back pain. I do see quite a few people with concussions. We typically start laying down and just introduce a little bit of movement to mobilize the joints, lubricate the joints, and just get the muscles warmed up. So some of these basic exercises and activities, I'll kind of walk through just a simple progression so you can see what sorts of things you could expect if you see a physical therapist. So Matthew, what I'm going to have you do is just rock your knees back and forth here. Good. And so we start just with some gentle movement back and forth just to get your hips and low back kind of warmed up. We do a fair amount of stretching and movement at first, and then you can stop in the middle here for me. And then we progress to some strengthening exercises and stabilization. And that's to help just protect those joints so that when you go to move, to do the things that you love, that you're not at risk for re-injury, and then you're actually going into this activity a little bit stronger. So we're going to do a bridge. So what I'd like you to do is think about pushing through your heels and just lift your bottom up towards the ceiling. Good. And then slowly lower back down. I'm going to have you do 2 more. And so now a lot of times the physical therapist is going to be hands-on if it's okay with you, facilitating the movement and kind of teaching you how to breathe while we do these exercises and activities. Good. Nice technique. Excellent. Good. All right. You can go ahead and sit up at the edge. And then further progression would be to do more of these weight-bearing activities. And so we might start laying down, but then we're going to start to stand up and move around. So what I'd like you to do is come towards the edge just a little bit. And you're going to stand up, bring your belly button forward, and then as you sit down, really push your hips back towards the edge of the table. Okay? Good. Excellent. Bring your arms down, and then as you come up, you'll bring them with you. Good. Excellent. We'll do 1 more. Good. And then have a seat. And so really the role of physical therapy, again, is to meet you where you're at, to help you move better with less pain, so then you can start to move better and get back to doing the things that you